Now many students are confused what to do, which branch to take, and all of us can share our inputs and maybe guide the students.
The interesting thing is everybody will walk to me and say, I will take up medicine, I will take up surgery, I will take up ortho, I will take up everything. And at the end, radio मिला मैंने radio ले लिया. एक महीने बाद कहानी सारी यहीं पे खत्म हो जाती है. So I don't know how it goes. There are two things which I realize are very, very important here, what I feel. One question that students have in mind is MDMS versus DNB. Second is, first option I am getting MDMS in another branch, but I wanted something which I'm getting in DNB. All right. The third point that people talk about is the saturation in branches. And if it's not an end branch, right, about the future exams. What I tell you is, if you love a branch, take it, whatever you're getting. Dr. Praveen already has made a video on the same, and he has also posted multiple times on the same. So if you know what you want, it is absolutely you should choose. It is just like if you know the person whom to marry, the venue doesn't matter. So choose the branch that you wish. That is all. And second, the saturation point is asked to me a lot in orthopedics. Look, a branch which is evolving with technology will never be saturated. There will be something coming up now and then. Knee replacement came, then computer came, then robot came. If you keep on updating yourself, you can never die. So any branch is there, you will always survive and progress. I was seeing a beautiful post today in the morning, which was मुकद्दर का सिकंदर में जो वो है अमिताभ बच्चन is riding a bike. There is a tempo behind and there is a scooter behind. Amitabh Bachchan is the only one out of the four things which kept on evolving and is still surviving. So whatever branch you take, you should keep evolving. Look at the example. You know what Goga Bhai said, scope bande mein hota hai. He took up a branch and he killed it. Then everything was killed with it. He started teaching on the board and was the pioneer of going online in medical world. So this is how you do it. You know, you look at Dr. Vivek sir, and he kept on creating books after books and books after books and kept on studying, where his guidebooks is being replacing actually the textbooks. I know he doesn't like me saying that, but सच्चाई को कोई बदल नहीं सकता. So I think we go to Dr. Dilip sir. Sir, there are certain things you would like to share about medicine as a career, as a physician, because if somebody comes to me, if we remember, if we look at AIMS counseling, सबसे पहला seat medicine का खत्म होता है. This is the first seat that gets over. It has been perennial throughout, right, Zainab? This is the first seat that gets over. Medicine gets over radio. पता जरूरी है सबको पता होना.
I was kind of ranked 32 in AIMS New Delhi exam during those days, and I couldn't get medicine, honestly. So this is something that's one of the most sought out fields. I mean, whether you believe it or not, whether you have studied medicine in undergraduate or not, anyway, you wanted to take up medicine somehow. So I think like first thing I wanted to say is the difference between the MD and the DNBs, because this is some question that I've been keeping on getting. So whether it's okay or not okay. So I can say from the perspective of what I am seeing in the DNB hospital for the last maybe 10, 12 years since I started practicing. Before that, I didn't have any exposure because I've been working only in the government colleges. But what I've seen with DNB is kind of more transparent environment, because generally you don't get the toxicity that you get in government hospitals sometimes. So it's more transparent environment. Consultants will be there. Yes, of course, you will not get more chances in the sense you will not get sometimes hands-on training maybe in the first 1-2 years. That's true. But you get to learn from medicine perspective. I think surgical perspective, Amrit sir is there to explain. But at least from medicine point of view, I can say the advantages are more with DNB compared to the of MD. So in the last 5 years, if you see, there is no stigma with regards to MD and DNB. The both guys are getting paid in the same fashion. Almost very opinion, if you get DNB in a decent hospital, just go for it. Don't stop just because you're not getting MD.
Sir, ortho, surgery, and gynae people come to you for intellect advice. Okay, noted, sir. We will talk to you.
Yes, sir. I mean, I'm not saying intellect advice, but the routine, sir. Most of their families, I'm only taking care.
This session may go in a very different direction.
यार ऑर्थो वालों को ना सब दिमाग वाला मानता ही नहीं है.
Sir, I'm not saying they're not coming.
Dilip sir, I have two questions for you, Dilip sir. You said that DNB medicine is as good, but do you think that in majority of the hospitals, the teaching, I mean, teaching may be very rudimentary even in the MD courses, but there has to be some teaching at least. Do you think that when it comes to teaching, maybe MD would be better than DNB?
Again,
And
sir, it's my own perspective
huh.
from people what I have seen around. So in Chennai, if you see, my hospital also has a DNB, not in medicine, but we have it in pediatrics. And if you see, there is another hospital called Sundar Medical Foundation, and for pediatrics, there's another hospital called Child Trust. Honestly, they do really well. They teach very well. And there are good teachers, and most of these teachers are actually retired professors from the government hospitals. And those are the ones who are like after retirement, they come here and they start their practice. So it depends again.
Yeah.
Obviously, like I don't know exactly about all the institutes, but what I've seen, like they do a good amount of teaching. The only cons I would say the surgical branch where they don't get good opportunities. That's absolutely true. But when it comes to medicine, most of the things, it's something that we observe and learn, according to them. So
and
more
so
than
the pass percentage, do we have any quantification? I mean, a couple of years back, it used to be very dismal. So I'm not sure whether it has changed or not. I mean, are we hitting 50%, 60% now?
yes, sir. I mean, when I go as an examiner, one thing I find is like people who really fail are people who don't know anything. And like very basics of basic questions. For example, I used to ask, maybe we start at an MBBS level, maybe at a final year MBBS level, the same level we ask the question. But once the candidate is not able to answer those questions, that is where they get failed. So generally, they don't get failed. So for example, last time in our hospital, the exam was conducted, 7 people out of 10 passed. I mean, that's a big number compared to the overall number. 7 out of 10 passed. And the remaining 3 who failed were basically people who didn't answer well at all.
Okay.
It all depends on like probably the knowledge. I don't think they purposefully fail in DNB.
Okay.
Like in MD, it may be possible, I feel. Maybe it's your own college.
In the past, the numbers used to be really bad, 10%, 20% pass.
Now it's better, I guess. Now it's improving.
It's better then it's good. Okay.
Dr.
Probably better because many people are taking up MD. I mean, DNB nowadays. I mean, boldly, they are good students are also sometimes boldly taking up DNB.
Yeah, one of our students only,
sir,
350
another
rank.
thing.
She took DNB in Gangaram Hospital, 350 rank only. I mean, she was getting everything, but Ria, I remember she took DNB in Gangaram Hospital medicine only.
Very good students. In fact, last year we had a DNB pediatrics candidate who scored like some 2,100 rank. Like he would have easily got MD pediatrics, but he took DNB pediatrics in Child Trust Hospital. Like I took DNB pediatrics in Child Trust Hospital. Like I can tell so many examples. Students are now good students are also preferring DNB.
I think one of the reasons is bond. There is no bond.
Exactly. No bond. Absolutely no bond. And you get exposed to, I would say, like environment is more neater, less toxic, and you don't have a lot of colleague pressure. Like because there are very limited students, you don't have so many units to work upon.
And so what are the disadvantages of DNB? I mean, you have spoken all the positive things. What are the bad things about DNB?
Bad things is only depending on the hospital, the exposure may be very poor, sir. And again, it is more individualized approach. But at least in MD, you'll have a whole group of people to work up. So one person is not teaching, other person might be still be doing something. But here it's totally consultant based. If the consultant is not good, if he's not speaking anything at all, and he's supposed to be like that for the next 3 years.
So in DNB, are we supposed to work with only one consultant?
It depends on the hospital again, sir. Many times, like some people may like somebody and they keep with them.
Okay.
The resident is good. So those kind of things might happen. But generally, sir, they do have rotational postings. They have specialty postings, everything. Cardio, neuro. Just like what you have in MD, everything is there in DNB also. The only maybe another con I can say is the case group exposure. Definitely, it will be less. It will be just 1/10 of what you see in MD.